Sounds good.
Hello, everyone, and thank you for joining us for today's class. My name is Donna Chow, and I'm your host and your moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is 10 practical, expert-approved formula strategies for all herbalists with Tatyana Rem, presented by Tatyana Rem. Today's webinar will be from 2 p.m. to 5 p.m. Pacific time, and we're going to have one break, and Tatyana will let you know when that is. For lecture notes, you can download those directly from your Blue Course Access page in your eLotus account. And the chat room. If you would like to participate in the chat, we do ask that you set your chat preference to everyone so that everyone joining us today, we can see what you are typing and we can have a conversation with you. And if you want to ask Tatyana a question regarding her topic today, her class information, please enter it into the Q&A box. Today's webinar is being recorded and you are welcome to watch the replay tomorrow afternoon from our TCM Wisdom Tube. Our speaker today is Tatyana Rem, and she will be sharing the top evergreen formulas that pretty much fly off her shelf in her busy practice. The majority of these formulas are Evergreen Collection formulas, which are family formulas created by TCM experts in various specialties who are Dr. John Chen's teachers. They are formulas that have been proven to work in clinical settings time after time. They are the most popular formulas sold by Lassa OMS, the largest needle and supply company in the US. This is the perfect webinar for new practitioners, acupuncturists who never studied herbs in school, or anyone who has a love of learning. More information about the formulas that Tatyana will be sharing can be found in the clinical manual of Oriental Medicine, and I'll share the link with you guys in just a bit. All right, let's go ahead and get started with today's class. Tatyana, please take over the class now. Would you please share your PowerPoint?
Okay, so let me try to figure this out. We've practiced this. Is it up?
Not yet.
Not yet. Okay. Okay. Share. How about now?
It's coming up now. So let me see. It's a blank screen at the beginning of the slide.
Let me see and show. Play from start.
Yeah.
Oh, good. Beautiful. Everything looks good?
Yeah, looking good.
All right. Yay. Great. Hi, everyone. My name is Tatyana, and I'm a licensed acupuncturist practicing in Silver Lake, Los Angeles, California. And I've been doing that for about 5 years now. However, I feel as though I've been practicing herbal medicine acupuncture for much longer. My family has been in acupuncture for a while, for many decades. And we've been also prescribing herbs to patients, or my mom has, and to ourselves. So you should see our home. We have like 30 herbs, my house, my parents' house, my sister's house. And this is how we stay healthy, productive, and avoid developing chronic conditions, which can take much longer to treat and sometimes cause irreversible psychological changes in your body. We only have one body, right, in this lifetime. And I've learned over the years that our thoughts and moods can also depend on physiology. So it's very important to keep ourselves in shape. So before I start, I have to mention my teachers. And this is my first lecture, so bear with me as I'm like trying to get myself in rhythm. So I have to thank all my professors at South Baylor University, Dr. Huey, Dr. Doan, Dr. Lin, my best teacher, my mom, who I practiced with, and of course, my dear Sifu, Dr. Jimmy Chang, without whose generosity and genius, I would not be here or not be where I am today. Okay, so next slide. In today's lectures, I will share what works for me and how I began my herbal practice. This lecture is designed for those, as Donna mentioned, who are new to herbal practice. And I just started to think, or those who are just starting to think about practicing herbs. I will share with you my experience and how I was able to build an effective herbal practice with minimal stress and good success from the start. And good success is very encouraging to keep developing your skills and growing more success and helping patients heal. So here's the course outline. Number 1 is how to begin using herbal formulas in clinical practice. Then we'll review collection formulas I use most in my practice. 3, review of how to use the Elos manual, which is a really great resource. It was my Bible when I started out. Dosing guidelines. Number 4. Then we're going to dive into 10 versatile formulas to start your herbal practice and really interesting clinical cases. And then we'll go into 6, how to avoid common mistakes. So drug-herb interactions, food allergies, and then caution and contraindications with women who are pregnant or nursing. Okay, so that's our course outline. So how to begin using herbal formulas in clinical practice. Like me, many of you might find it intimidating to start practicing herbs. Personally, I do not like to make people suffer. It's very stressful and uncomfortable, and you feel bad. And that sometimes deters me from moving forward. But my mother-in-law, who is a midwife, said something that really stuck with me. And she noted that some healthcare practitioners make a mistake. For some healthcare practitioners, making a mistake can cost a human life. Like in surgery, and my mother-in-law assists in surgery, so she sees all kinds of things. So when you think about that, prescribing herbs is not as scary, as herbs have minimal side effects. In the end, you are going to be making mistakes, but for me, it was helpful to remember that you can only learn from experience, and you have to keep going. So TCM practitioners, are not magicians, but with practice, we can get closer to magic, as patients will tell you, when you can clear ailments quickly and effectively. But the more I practice herbal prescription, the more patients comment, it worked like magic. Oh my God, my symptoms are just gone. However, still to this day, there are challenging cases that walk through the door that take time to figure out and treat. And sometimes you have to give it multiple herbal combination tries. But this is what makes our work interesting. It's a work of investigation, creativity, and at the end, the result is helping people feel better and many times making them feel like they've come alive again, which is incredibly rewarding and exciting. Communication with patients is key in challenging cases that are not as straightforward or new to you. When I see a complex case, I educate my patients more on why their case will need more time to treat and what my treatment strategy is. This is step 1, 2, 3, and then let them know that we will see how their body will respond to each step. When you educate patients, show your knowledge and give a plan, there's a better partnership between you and your patient. And this really encourages treatment follow through. Okay. So number 2, it was very helpful to start my practice with, and I continue to do this, to use these Evergreen Collection formulas for the following reasons. 1, they're preset balanced formulas with versatile application and proven effectiveness. And that means that these formulas really minimize the amount of time, effort, experience, and research you need to do to prescribe herbs. And 2, capsule forms are really easy to take. Unlike decoctions and powder formulas, a lot of people who are new to herbal medicine can really have a hard time with taste and really, mixing it on water or heating it up, making teas. So follow through is much easier with capsule form when you start out. And there's familiarity, right? So patients are used to taking medication, again, capsule form. 3, when you start your herbal practice, find support and good reference information. So mentorship, professors, lecturers. The eLotus community has a lot of resources on elotus.org. And again, the eLotus manual, which is a big resource. and I will go over that today. There's also Evergreen resources. We have Tina and John Chen, co-authors of herbal reference books that you can reach out to. Also, as you begin your practice, it's important to keep in mind how to avoid common mistakes. And we will go over more about this at the end of the lecture. So in general, herbs are safe with very few side effects. A few things that you need to note, however, is that you want to be careful giving large amounts of tonifying and hot natured herbs to individuals with hypertension, and also prescribing blood movers to individuals on blood thinning medication. 3, you do want to stop all herbs before any surgical procedure. And this is something your surgeon should also, or your patient's surgeon should also mention to them. They stop all herbs and supplements. And also keep in mind sensitive patients. With practice, as you get to know your patients longer, you will be able to distinguish and adjust dosage accordingly, or just do acupuncture in some cases, if the patients are very sensitive to herbs. With sensitive patients, it's important that you educate them about their sensitivities, follow up with the patient after prescribing herbs to make sure they feel good, have them be able to contact you in case they experience any side effects, is crucial. I had a patient who had the opposite reaction to almost every medication she took, and the same was with herbs. So very unusual reactions to herbs. It was easy with her because she knew her condition, but most people have a bad reaction after taking herbal formulas and get intimidated. So patient follow-up and education is important. And finally, pregnancy and nursing, we want to avoid downward draining, blood moving herbs, and herbs with a toxic profile. Those should be avoided or used with caution. In general, Dr. John Chen recommends not to prescribe any herbs to expectant mothers, just to be safe. Here are the 13 systems Evergreen Collection formulas categorizes all their herbal formulas into that you can review. So I have endocrine, gastrointestinal, hepatic, gallbladder, cardiovascular, respiratory, and the list goes on. This is the way I kind of categorize the herbs I have in my practice. So I have one for stress, sleep, and nervous system balance support, digestion, injury, pain, infection, genitourinary system, menstrual support, skin, kidney, gallbladder stones, thyroid, headache, cholesterol, and then degenerative deficiency conditions. So as you note, I put some herbal formulas in bold. Those I use the most. So I typically have this cabinet with all my herbs at the front desk. And usually I have 3 units of each herbal formula. But for Calm, GI, and Herbal BX, I have 9 because they just really are getting used a lot. And we need more of those. So if you really want to start with just 3 formulas, just to put your foot in, those are the 3 that I recommend: Calm, GI, and Herbal BX. And we'll go over them as the lecture progresses. And there's lots of really good information. So when you click on Evergreen Collection Formulas, full explanation, you'll get something like this, which has a list of all these amazing formulas. And if you click on symptoms and disease, you can search a particular ailment and then see what formulas will apply. So it's really easy to kind of go backwards. So if you're presented with a case and you're like, oh, I'm not sure, you can look up the symptom or ailment with this feature. So for example, for lower abdominal pain due to menstrual cramps, you would go for men's ease. But for the third selection, lower abdominal pain due to pelvic inflammatory disease, you would go for V support. So here's an example of when you select the Calm formula for the full formula explanation. You'll get all these categories: clinical applications, Western therapeutic actions, Chinese therapeutic actions. So it's nice to compare Western and Chinese terminology. You have a list of ingredients, dosage, background, formula explanation, caution and contraindications, clinical notes. Then you have supplementary formulas that you can combine for different conditions, acupuncture treatment, nutrition, lifestyle instructions, and lots of case studies. Pharmacological and clinical research, and all these references, and there's a lot. Okay, so next is dosing guidelines. So when you prescribe herbs, of course, you want to know how much, how frequently. So for each person, each person is unique, and you have to dose individually. That's important to know. So you really have to look at what's in front of you. The standard dose, however, for an average adult is 6 grams per day, and 1 capsule is 0.5 grams. So that's about 4 capsules 3 times a day. That's our usual, most typical prescription. Evergreen recommends to take herbs on an empty stomach 1 hour before meals or 2 hours after meals. However, I find that a lot of people have irritation in their gut lining, their stomach lining, from stress and poor eating habits, poor food choices. And so more often than not, they get a little bit of more irritation from herbs. So I typically prescribe 15 to 30 minutes after each meal with warm water. You do want to take herbs 2 hours apart from any prescription medications and supplements. And again, you have to take, or it's very helpful to take with warm water because it dilutes the capsule and really helps with the absorption and digestion of the herbal formula. Also, don't take it with juice, coffee, or tea because that can alter the properties of the herbs. For acute and severe cases, dosages may increase up to 20 grams per day. And we'll go over that in more detail in the next slide. When in doubt, you can always start with a lower dosage and then slowly increase until the desired effect is achieved. And also, as symptoms and conditions improve, you can choose to decrease or pause the herbs. So for an average adult, again, it's 4 capsules 3 times a day after breakfast, lunch, and dinner. Usually for smaller females, I do 3 capsules 3 times a day. For children below 5, we do 2 capsules twice a day or 3 times a day. If there is no effect, and this is very helpful, you want to double the dosage to see if there's improvement. Or you can do just 6 times 3, a little bit lower. You can do extra dosages before bed if there are nighttime symptoms. So it would be 4 capsules 4 times a day, after breakfast, lunch, and dinner, and then before bed. And that's for cases of insomnia, or they have acid reflux in the middle of the night, stuffy sinuses, something that prevents them from getting good, deep, restful sleep. So we added that end of day dosage. For severe acute condition, for an average adult, you can take 4 capsules every 2 to 3 hours, or even 6 capsules every 3 hours in a 12 to 24-hour period. Sometimes we do even 8 every 3 hours. And this is for high fevers, excruciating pain, where you really need to help the patient out. And usually if we do combination treatments of 2 formulas, it would be 8 capsules. So 4 of GI Care, for example, and 4 of Calm. We had a case of peptic ulcers, and pain was triggered by diet and stress. So we chose GI Care and Calm. And we have that case study later on in the lecture that we can dive into. So the Evergreen website also has dosing guidelines based on age groups that you can reference, also based on weight. So you might want to consider both on a case-by-case basis. So here, now let's start with the 10 versatile formulas. The first one being Calm, which is one of my favorites. So we'll start with clinical applications. And this is all in the eLotus manual. So some of the information I extracted from that resource. So for clinical applications, we have stress, anxiety, nervousness, restlessness, and Calm helps with generalized symptoms of stress. So poor appetite, headache, tension, and insomnia. It's also very good for PMS. So the Western therapeutics include calming effect to relieve restlessness and irritability, anxiolytic function to relieve stress, nervousness and anxiety, and an analgesic effect to relieve pain for headaches, muscle tension associated with stress. The Chinese therapeutic actions include spreading liver qi, nourishing liver blood, clearing heat, and harmonizing the middle jiao. So as we know, I think it's in the next slide here, ingredients. Here's an ingredient list you can review. But we know that stress affects the liver qi stagnation. It's the first organ to respond to stress. And then when the liver is agitated, it tends to bully other organ systems. So you can go into the lungs, you can have cough, dry cough from stress. It can target the stomach. So you have acid, GERD, gastritis, ulcers from stress, or it can target, for instance, the lower intestines and cause IBS. So it really depends on the person's constitution and medical history where that stress effect is going to go to. So we know that stress is a normal physiological reaction to demands of life. So we enter into a fight or flight response. And typically what happens in a fight or flight response is the blood flow prioritizes the brain and the muscles to give you that energy to run away or fight. And it really diminishes circulation in internal organs, which really affects organ function, how the immune system works. So when stress becomes chronic, that becomes a problem. So our bodies can really take a hit. And that's really when disease starts, is when we have that dysregulation and interruption in blood flow. So we can't regulate our hormones, our organ function is down, etc. So calm can really help prevent a lot of ailments that are born from stress. So next we have the full formula explanation. But I'm only going to pick out important key factors so you don't get overwhelmed. But you can always revisit this PowerPoint slide or the eLotus manual for all that good information. So it's really interesting that calm is formulation based off of the classical formula Xiaoyao-san or Jiawei Xiaoyao-san that we're all very familiar with from acupuncture school. However, the difference is, and I find that calm is a more modernized and improved version of Xiaoyao-san and Jiawei Xiaoyao-san, and is overall better and more effective. So I've tried both, and calm really, I can feel the effects really quickly. In some cases, actually, Xiaoyao-san didn't help as much. Okay, so here I wanted to note the key differences between stress and anxiety. So stress typically, I find, has to do with irritability and frustration, versus anxiety is more restlessness combined with a feeling of emptiness. Stress typically comes with digestive distress, as does anxiety, but not as much. With anxiety, you have more of overthinking, worry, and fear. With stress, you have more mood swings. With anxiety, you can have a little bit more of palpitations. A key differential sign is in the liver pulse, you'll feel an excess jump for stress. For anxiety, you'll feel kind of a weakness in the left guan. And the way we take pulse signs is through Jimmy's method, Dr. Jimmy Chang's method, where the styloid process on the radial artery divides the chun and the guan positions. So it's not the typical ones that you learn in acupuncture books in school. So, so mood can be affected from other causes. And what I mean by that is that you can have a stress from the environment that affects the body, or you can have a dysregulation in the body that affects the brain. So it can go both ways, from the outside in versus from the inside out. in a way. So for example, when the body's in disbalance, it affects the brain to interpret things as stress. You can have an inflamed and congested liver. So when the liver is off balance because of poor eating, overindulgence in alcohol, a person can experience stress. And for those cases, you can use herbal formulas like liver detox, Gentiana, gardenia, which we will review later on. In addition to that, if you have thyroid disbalance, like hyperthyroidism, it can overstimulate the adrenal gland to release cortisol and can cause agitation and stress. So Calm helps with both, for sure. But you might want to combine, depending on the cause of stress, with other formulas if they come from the body out. Okay, so that's just wanted to note that important thing. Next slide. So for the cautions and contraindications for Calm, we want to avoid prolonged use because it can cause G deficiency. So you do want to resolve or look into the stressful lifestyle or whatever the underlying condition of stress is. This formula also has blood invigorating herbs, so you want to be careful with people who are on anticoagulants and antiplatelets medications. Okay, so here's our first case study. So for Calm, we have a female who's 24 years old, and her chief complaint is stress with symptoms of dizziness and fainting. Patient is working at her first job right out of college with grant deadlines, long hours of writing and computer work. So for observations, we have a slender body type. She's very empathetic and sensitive. And for the pulse, it's overall weak, again with a wiry guan, so liver qi stagnation. There are no major health concerns in her medical history. Upon investigation, patient does not eat breakfast. She skips it, and she drinks coffee in the morning to get going. And the patient also suffers from dysmenorrhea and cystic chin acne. So for our diagnosis, we put hyperactive adrenals, liver qi stagnation, heat and blood stagnation in the lower abdomen, and an overactive yang hormonal disbalance. And let me go through each one. So hyperactive adrenals. So typically, low blood sugar levels equals high cholesterol levels, cortisol levels, I'm sorry. The two are inversely proportional. So when we wake up in the morning, we wake up with low blood sugar levels, and our body preps us to like hunt and gather, releases cortisol. But instead of eating, most people in modern day life, they just use it on work. And that really spends a lot of our vitality. And cystic chin acne is typically due to excess yang hormones or testosterone due to stress, and therefore high cortisol levels. So this kind of explains why we put the diagnosis that we did. Okay. So our prescription was Calm 3x3 because she was more petite, smaller female, and we don't want to over-medicate her. Recommendations were to stop stimulants, which can exacerbate feelings of stress and the symptoms that come with it. We want to eat a protein-rich breakfast along with good fat, complex carbohydrates, and fiber to downregulate that spike in cortisol levels early in the morning and really even it out throughout the whole day. And of course, some stress relieving practices like Qigong and meditation would be helpful. No referrals yet, some acupuncture points to spread liver qi and calm the nervous system down. And because her pulse was weak, we do want to nourish some qi and blood. The outcome that we saw was an overall, the patient felt little to no fainting spells, and she felt calmer. So this is a very good, successful case. Let's see here. Now, with her symptoms of dizziness and fainting, we'll go back, can be a signs of either excess or deficiency. So dizziness and fainting can come from excess heat, phlegm, liver wind rising, or deficiency of qi and blood. So not nourishing the upper body enough. In this case, more investigation was imperative to really distinguish between the two. In this case, dizziness was due to deficiency, given her constitution and her pulse. Okay, so for next treatment, focusing on hormonal balance and resolving stagnation in the lower jiao to address acne and difficult periods was the plan. Because long-term stagnation in the lower jiao, especially in combination with hormonal disbalance, can lead to pelvic inflammatory diseases like PCOS, fibroid cysts, endometriosis, problems with infertility. So noting that, that was our next kind of course of action. And Calm is already going to start working on that because it's going to help spread liver qi, which will deliver even distribution of blood flow and qi to all the necessary parts of the body. Okay, so some other uses of Calm. We can really do preventative treatment for PMS a few days before menses and even PMDD. And that's premenstrual disorder, which is a more intense case of PMS, where women feel completely just out of control and moody and anxious. And the way the Western the way that the Western doctors treat this is through SSRIs and birth control, which can disrupt normal brain chemistry and hormonal balance that can cause many side effects, and not really addressing the underlying issue of liver qi stagnation, which of course, if left untreated, can progress into something more serious. So it's better to always try something less invasive with minimal side effects. And you can always go with SSRIs and birth control if those treatments are not helpful. Also, you can use Calm to push and start menses. So sometimes liver qi stagnation can be so intense, they can cramp up the lower abdomen and really prevent the period from starting. So you can really prescribe a high dosage of 8 and the period will come right away if the patient has liver qi stagnation. Okay, combine Calm. Okay. So for the additional notes, it's also important to combine cardio to spread liver qi and clear heat. That's very helpful to really help the body move liver qi. So our typical anti-inflammatory diet, which we recommend to most people to help relieve the burden on the liver and just the whole body, is we want to minimize sugar, including honey and fruit, spicy foods, alcohol, dairy, processed foods, and lectins. And lectins are plant proteins that can really cause a lot of disruption in the gut, and gluten is one of them. So when we're treating really stubborn cases, the anti-inflammatory diet is a must, because it really helps unburden the body and facilitate really fast, good healing. It just relieves the stress that the body is experiencing from diet, which is a major component. Okay, so our next formula is GI Care, another one of our favorites that just flies off the shelf, and we have 9 in stock at all times in the front. So the clinical applications are peptic ulcer disease, gastritis, acid reflux, generalized gastrointestinal disorders. The Western therapeutic actions are anti-ulcer, anti-acid, antibiotic in cases of H. pylori, an analgesic effect to relieve stomach pain typically, and has a gastroprotective effect to restore normal digestion and gastrointestinal functions. There's a number of herbs I travel with, and GI Care is number 1. And just one dosage of it sometimes is enough to relieve travelers' diarrhea and food poisoning. It's really incredible. Okay, so the Chinese therapeutics, it quells stomach fire, stomach inflammation, heat, spreads liver qi to help prevent the liver from bullying the stomach, and it strengthens the middle jiao to promote digestion. Here are the ingredients that you can review. For caution and contraindications, it's important to note that patients with atrophic gastritis, which is the decreased or lack of secretion of stomach acid, GI care is not suitable. So GI care is mostly for patients who have excess acidity. So patients with cholecystitis and cholelithiasis, so gallbladder issues are sometimes misdiagnosed, and it's important to note that. And how you'll be able to know that is that the symptoms for cholecystitis or gallbladder stones is severe pain in the upper right belly, and there's bloating. Also, there'll be a sharp pain when pressed on the upper right part of the abdomen. Breathing deeply can worsen the pain. And pain also extends to the lower part of the right shoulder blade or the back. So these are just clinical symptoms that help you distinguish in the rare case that it's not gastrointestinal distress, but has to do with the gallbladder. Also, you can look out for nausea and vomiting, which are common with cholecystitis. Look out for jaundice and dark urine. For stomach pain, however, it's going to be typically on the left because the stomach is slightly on the left side of the body, and gallbladder is on the right. So just a caution and contraindication when you're addressing gastrointestinal issues with GI care. Okay. Okay, we're ruling out again atrophic gastritis. So GI care treats again only excessive secretion of gastric acid. So patients with low acidity will feel worse with GI care. It's important to note that sometimes non-steroidal anti-inflammatory drugs can cause ulcers, but they'll be asymptomatic. So it's important to, it's an example of why it's important to review a patient's medical medication list to get a complete picture. Okay, so that you don't miss that when you see a patient. So for hyperacidity, one of the easiest way to detect that is a forceful pulse on the right guan. So that's the stomach, and it'll be excess. So that means the stomach is hyperactive, there's extra acidity. For hypoacidity or lack of acid, that's stomachian deficiency. And you'll notice a weak pulse on the right guan, so the stomach pulse. So that's one easy way to distinguish. You can also look at ear signs, the tongue. Okay, but primarily almost all cases are of high acidity when people experience stomach pain and discomfort. So for our case study, we have a female of 38 years old, and her chief complaint is stomach pain, acidity, and indigestion. The patient has a stressful job in directing and producing. She's working very long hours, frequently has indigestion of different foods, prone to constipation, chin acne, and a lot of pain during menses. Observations, another slender and petite body type, very responsible, tends to hold in stress, no major health concerns in the medical history, and the tongue is red. So our diagnosis was liver overreacting on the stomach. Prescription was GI care, 3 capsules 3 times a day. And given her constipation and stress, we recommended a liver and gallbladder detox diet, which incorporates beets and papaya. Papaya really helps evacuate the bowels through digestive enzymes, and beets is a very good detoxifier for the liver. No decreased fatty fried foods, and the anti-inflammatory diet to soothe stomach, so particularly spicy, sugary, and sour foods. Stress management, some acupuncture points, really effective ones are the Ashi points on the pericardium and large intestine channels for the stomach around the elbow. It really helps clear stomach pain through distal needling, and some Ashi points on the stomach too. The patient felt significant improvement in stomach acidity and discomfort. She was very happy. Next treatment, we're going to focus on balancing the nervous system, clearing stress, relaxing liver qi, and nourishing the spleen to help the stomach. So spleen and stomach are husband and wife. So if a person is overworking and their spleen qi is down, its counterpart yang organ stomach is going to be in distress, so hyperactive. And GI care already has properties that spread liver qi stagnation. So we didn't see a need for calm, but you can definitely add it when stress is high to support the patient more. Because this was her first visit, we didn't want to overwhelm her with too many herbs, so just GI care was enough. Okay, next slide. Some more uses for GI care, as I mentioned, is food poisoning, traveler's diarrhea, and diarrhea due to stomach inflammation, irritation. Sometimes when you eat something often, that immediately triggers you to have a bowel movement at a restaurant. GI care is going to be your saving grace. And we did have an ulcer case highlight. So a patient who had initial stages of ulcers went on medication and it was not helpful. She was still experiencing a lot of pain. So prescription of GI care and calm was successful because her ulcers were induced by stress and wrong diet. And again, diet here was very important to help heal the stomach lining. So herbs really can help decrease pain and inflammation and irritation in the stomach lining. But if you continuously introduce inflammatory foods that are agitating for the stomach, it's not going to be very helpful. So again, no spicy, sugary, or sour foods, including coffee, which is very acidic. Yeah, this patient was very impressed. She felt better, much, much better within days. So our next formula is Gentiana complex. So the clinical applications for that, applications are hypertension, excess type viral infections, bacterial and fungal infections, liver and gallbladder disorders. So we have acute hepatitis, acute cholecystitis, which is gallbladder stones. We can treat genital herpes, herpes zoster, urinary tract infections, vaginal infections, yeast infections, herpes, boils, carbuncles, acute cystitis, which is inflammation of the bladder, and so on. So the Western therapeutic actions are antihypertensive to lower blood pressure, antibiotic, antibacterial, antiviral, hepatoprotective, and cholinergic, so clear gallbladder stones, or no, I'm sorry, to help excrete bile and protect the liver. We have anti-inflammatory effects. Chinese therapeutic actions, Gentiana complex really helps drain fire from the liver and gallbladder channels, clear damp heat in the lower jiao, so anything in the lower abdomen. And damp heat really means infection in Chinese medicine. And it also nourishes yin. So a lot of good effects. These are the ingredients, which I'm not going to go over into too much detail. So typically, Gentiana complex helps with also cardiovascular disorders, so hypertension, infectious diseases, inflammatory disorders, and those affecting liver, gallbladder, and pancreas. So it's not just about the liver and gallbladder. So heart, liver, gallbladder, and pancreas are also considered to be fire organs. So those are also benefit from Gentiana complex. Okay. So here, so fire in the liver, gallbladder is characterized by headache, red eyes, hypochondriac pain, bitter taste in the mouth, deafness, swollen, painful inner ears. But of course, in clinical practice, we might see one or none of those. But it's a good kind of representation of what we should visualize when we use Gentiana. And of course, damp heat, which can result or manifest as swelling, itching in the external genitalia, sweating in the groin, rashes in the groin area, dysuria, turbid urine, and leukorrhea in women, which is typically of excess type, which is yellow and foul smelling. Okay. So some of this extra information I'm going to pass through, so not to overwhelm you. I'm just going to select important details that are worth mentioning in the beginning. Okay, so for cautions and contraindications, for malignant hypertension and secondary hypertension, we have to refer the patient out to a medical doctor. So for those cases, and secondary hypertension, something from that can result from like kidney failure. So that's when a patient needs to see a medical doctor. Typically, we always recommend that our patient sees a medical doctor first to get a diagnosis and a checkup to make sure there's nothing life-threatening, and then come to us. So that's typically a good rule to follow. Okay, just some extra details. For clinical notes, there are two formulas, the Gentiana complex and V-support, that are similar in treating damp heat in the lower jiao. However, the key difference is that Gentiana lowers hypertension, so liver yang rising, versus V-support just targets damp heat in the lower jiao. So if you don't have any signs of too much fire in the system overall and hypertension, V-support is going to be more ideal. And we'll go over V-support. So typically also viral vaginitis is best treated with Gentiana complex. Bacterial vaginitis is typically better treated with V-support. It's just some key differences. So here's V-support. So there's a lot of overlap between the two. Gentiana and V-support. So vaginitis is treated by V-support, pelvic inflammatory disease, UTI, genital eczema, damp heat vaginal discharge, which is yellow or green, orchitis, and epididymitis, which is swelling of the testes, inflammation of the scrotum, and the male genital region. And you notice that a lot of symptoms that V-support and Gentiana treat are in the groin area. And that is because the liver and gallbladder channels primarily go to those areas. So it's kind of like a root and branch connection. Liver and gallbladder are overwhelmed, the channels will dysfunction, and you can have disease in those channeled areas, which for liver gallbladder is typically in the groin area. Okay, V-support also treats candida, infertility. We'll skip over Western therapeutic actions because they're very similar: antibiotic, anti-inflammatory, etc. For the Chinese therapeutic actions, again, it's damp heat in the lower jiao, damp heat in the liver, gallbladder, urinary bladder channels. It promotes diuresis and blood circulation in the lower jiao. So very similar to Gentiana. So we have a Gentiana complex case study. A female of 47, and her chief complaint is frequent and urgent urination and general discomfort in the bladder, which can be very annoying when you have to go use the restroom all the time. Her urine test showed no infection. The MD diagnosed it as a non-infectious cystitis, so just simply inflammation of the bladder of unknown origin. Patient is a stay-at-home mom. She enjoys spicy and greasy foods, spends a lot of time taking care and worrying about elderly parents, does not have a regular exercise routine, sometimes takes walks around the neighborhood. Observation: she's kind of small, 5'4" in height and mildly overweight. And of course, she's stressed and busy and doesn't spend time to rest and do self-care, which is typical for a lot of women in the modern day. Her medical history: she does have hypertension, high cholesterol. So already from all those details, we can see that she needs help with clearing liver gallbladder stagnation and congestion, greasy, spicy foods, stress, lack of exercise to move liver qi, and of course the bladder urinary symptoms that she's complaining or suffering from. The tongue was swollen and pale, so a little bit of qi deficiency there due to overwork and overworry. Diagnosis, not a surprise, spleen qi deficiency, liver gallbladder and qi stagnation and heat. Our prescription, Gentiana. And the reason for that is because she does have hypertension, so we want to help clear that for her. A V support would have helped also, but in this case, Gentiana was a better fit. Our recommendation is the liver gallbladder detox diet, so decrease red meat, fried greasy foods, nuts, nut products, spicy, and alcohol. In this case, nuts and nut products can really congest the liver gallbladder because they're difficult fats to digest. So we typically always recommend to avoid those with liver gallbladder, qi stagnation, and heat issues. So in acupuncture points, the most important is Ashi and gallbladder 34 to open up the bile duct and help detox the liver gallbladder. Liver 5 at some points to clear qi stagnation and support nourishment of qi. So the outcome after first treatment and herbal intake, patient felt her symptoms improve. After 2 to 3 weeks of treatment, patient symptoms cleared. So it was a very good effect. Next treatment, patient's lifestyle exhausted her qi and yin, which sped up the onset of perimenopause. So we were focusing on replenishing kidney yin after we cleared her initial symptoms. In fact, women who are around perimenopause, menopause age typically have yin deficiency, which can result in more dysregulation in the body, one of which is more contractions of UTIs or occurrence of cystitis. So if you have trouble clearing something like, what was it? Frequent urination. I lost my spot here. And general discomfort in the bladder, add Zibai Dihuangwan to replenish kidney yin for women who are around the perimenopause, menopause age group. That's very helpful. Some additional uses for Gentiana is nausea due to liver gallbladder congestion. So you might not have any symptoms, but if you had a fatty meal and you're nauseous, take a dose of Gentiana. That will really help you. Also irritability due to liver and gallbladder congestion. You can also take 1 or 2 dosages and that will clear it for you, even if you don't have any other symptoms. We had a very interesting abscess case. So so we had a female in her late 30s who experienced a lot of stress, drank alcohol, and she also read an article how eating nuts was very good for her. So she was really indulging in them. And again, nuts and nut products, very difficult for liver gallbladder to digest, can cause stagnation and congestion. And she developed an abscess near her anus that later began forming a retrovaginal fistula. So again, liver gallbladder problems manifested as an abscess in the groin area. And a fistula, a retrovaginal fistula, is an abnormal connection between an organ, vessel, or intestine and another organ, vessel, and intestine. So you're pretty much creating a pathway between 2 organ vessels or intestines. And in this case, it was between her anus and vaginal canal, which is not a good condition to have. And there's lots of pain, possible infection, most likely infection because of fecal matter entering places where it's not supposed to. And for this case, Gentiana was really a lifesaver. It really helped her clear swelling, inflammation, and pus, and prevented the fistula from fully forming. So here I'll show you a little photo We have the rectum, and so the fistula was about to form where that red circle is. So it was going to connect, because of an abscess, it was going to connect the rectum with the vaginal canal, which is really excruciating. It's uncomfortable and just a bad situation to be in. She was also working with her surgeon to really help prevent that fistula from fully developing. So simple things like a congestion in the liver gallbladder organs can really cause that root to branch symptom, like a fistula and an abscess. Very interesting. Okay, so next formula is liver detox. A really good one. They're all great. So for the clinical applications, we have liver detoxification, prevention of liver damage, which you can see through elevated liver enzymes in the blood work, hepatitis, inflammation of the liver with or without jaundice, liver cirrhosis, which is scarring of the liver tissue, from alcohol, drugs, and other chemicals. Can also really help with addiction treatments. The Western therapeutic actions are enhancing liver function, regeneration of liver cells, protects the liver from damage, preventing and repairing liver damage in cases of liver cirrhosis as an antioxidant effect, and lowers hepatic enzymes, which tend to spike when the liver is in trouble. So for Chinese therapeutic actions, we have clear heat and eliminate toxins, spread liver qi, drain dampness, and tonify deficiency. And that's typical dosage, 3 to 4 capsules. Here are the ingredients that you can reference back to. This is just typical information about the functions of the liver and how liver disorders happen. So infections, drugs, toxins. So those are helpful. This is the formula explanation that I'm going to scooch by, that you can reference back. It really explains each individual herb and what it does within the formula. Cautions and contraindications. So liver detox is contraindicated during pregnancy and nursing and should be used with caution in cases of qi and yang deficiencies. So do not use this formula for acute liver failure. And you want to decrease dosage if there's too much loose stools. But that's also kind of how liver detox works, is the liver detoxes through the large intestine. So it has to move stool. But if it's too much, decrease dosage, because we don't want to make the patient dehydrated or uncomfortable. Some clinical notes that I found interesting. So there's seasonal factors in treatment of hepatitis with liver detox, or in general, if you treat hepatitis in the liver, it's less effective in the spring and summertime because liver qi is damaged in the yin more in the spring. And in the summer, there's more prevalence of damp heat. So if you're clearing dampness and heat, it's going to be harder to do so in the summertime. And of course, dietary restrictions. If we want to improve the condition of the liver, we need to stop abusing it and bullying it with alcohol, hot and spicy foods, and other inflammatory foods that I mentioned. Here's our case study. We had a male who's 67 years old. His chief complaint was back pain and elevated liver enzymes in his blood work. The patient takes a lot of painkiller medication for back pain, had 2 nerve ablation surgeries, and due to chronic back pain. Patient works long days in construction, has no exercise regimen aside from physical activity of work. Patient's diet consists of primarily meat, carbohydrates, and processed sugar. Patient is reluctant to make any lifestyle changes, unfortunately, and has a sugar addiction. So he's mildly overweight, but has a lot of muscle mass and tone because of his work. medical history. He has high cholesterol, inflammatory factors in his blood work, elevated liver enzymes, which is his chief complaint, one of his chief complaints. He also had brain surgery to remove a benign tumor. Complications included ageusia and dysgeusia, which is changes in the how the tongue tastes certain foods. So you have either no taste or changes in taste. Everything can taste metallic. And that was due to his brain surgery. His ears and tongue were red. So diagnosis was systemic. The diagnosis was systemic heat and inflammation. Our prescription was liver detox 4 times 3. We have the liver gallbladder detox diet. And we also gave him a referral to a therapist. Okay. For his addictions to sugar, which is causing this incredible inflammation in his body. A side note, nerve ablation is a procedure in which a portion of the nerve tissue is destroyed or removed to cause an interruption in the pain signal and reduce pain in that area. So because of inflammation, his back pain was so severe and nothing would help that he literally had to cut the nerve, which is not good. So for the outcome, while acupuncture helped temporarily for his back pain, it did return because there's so much inflammation due to poor diet and lack of proper circulation. It was later discovered that the patient has psychological dependency on sugar to help alleviate anxiety from childhood trauma, which is why we gave the referral for the following therapists or therapies. In this case, what we helped the patient with was temporary pain relief and minimized liver damage. In the end, the patient chose to have another nerve ablation procedure to help relieve his back pain because lifestyle changes were challenging to make. But for the outcome, in terms of his liver enzymes, over the course of 4 weeks, the patient's blood tests showed that his liver enzymes were normal, which the patient described to me his doctor was very impressed with. I was like, oh, what happened? So the patient was very happy with that. So at least we're helping him with his liver function and keeping his liver in good health. Okay, so other uses for liver detox. So sometimes we can have low energy because of liver congestion. If you have no other symptoms, but low energy, check the liver pulse. Look for signs of liver trouble, and you can help really increase good energy levels with liver detox. So also mood issues to liver congestion, such as irritability, depression, negative thinking. You can also help with liver detox. And for those cases, the liver pulse will be really excess and high. Also, it's a very good cure for hangover. So after you had a night of drinking, pop in for capsules of liver detox to help protect your liver before or after, or both. So you can prevent that liver damage and a hangover. Okay, so our next formula is Flex TMX. So this formula is really incredible for traumatic injuries, broken bones, and fractures post-surgical recovery. So any trauma, physical trauma, so car accidents, falling. So it has an analgesic effect, anti-inflammatory, antispasmodic, hemostatic effect to stop bleeding from trauma and injuries, and the circulatory effect to help facilitate healing. So this is our kind of SOS formula post any injuries. The Chinese therapeutics are invigorate blood circulation, clear blood stagnation, relieve pain, helps regenerate bones and soft tissue. It's really incredible to see in practice how fast people heal and how much the pain clears. These are the ingredients. So acute injuries are typically severe pain, swelling, inflammation, internal bleeding. Chronic injuries are dull pain, stiffness and numbness, decreased muscle mass and strength. So Flex TMX helps with both. but typically we use it for acute injuries at the clinic. Let's see. What else is important? Just some caution and contraindications. Pregnancy and nursing, it's contraindicated for, of course, blood moving properties. For concussions, we need to refer to the hospital. Again, typically the patient will see their doctor first in the ER or urgent care to make sure there's no hemorrhage, something serious and life-threatening, then come to us for help. Of course, serious internal bleeding, we need to refer out. And this formula is not designed for long-term use. It's just in acute phases of injuries. And patients who are on anticoagulants and antiplatelets needs to be careful with this herb as it is a blood mover again. So I have a bunch of case studies. So for Flex TMX, we have a male who's 67, post-operation care after surgical procedure. He reduced muscle volume in the arm. The prescription was Flex TMX. Really saw not immediate, but very quick and nice healing. So one of the things that Flex TMX really does is it prevents the formation of adhesions and scar tissue, which kind of minimizes loss of tissue function post-operation. So for second case, we have a female 22, post-operation care, double eyelid surgery. Again, plastic surgery, you want to minimize scarring, especially on the face. So she saw very good healing. And always in the post-operative care, health professionals are very impressed how good the patient has been healing when taking Flex TMX. Some also asked, what are you taking? Because you're healing so nicely and so well without complications. Third case, male 32, post-operation care, lipoma removal on the back of the neck. Again, minimal swelling, nice healing. Sometimes there can be complications. Post-surgery, infection, pain, like swelling, and just tissue is not happy from that surgical stress. So male 52, we had a forehead lesion post-car accident. Patient was riding a bike at nighttime. Again, he felt a lot of pain relief and good healing on Flex TMX. We had a female 51 whiplash post-car accident, again, Flex TMX, even though there were no visible injuries on the outside. Flex TMX helped heal, whatever inflammation and damage the whiplash had done. And she felt good pain relief, and it really cleared her tension in the neck and stiffness, along with the pain. So for all those cases, we prescribed 4 capsules 3 times a day. We also did the anti-inflammatory diet, very important for tissue healing, for proper tissue healing. So the outcome was minimal scar tissue formation and other complications. Good, so very good formula. Okay, so now it's time for a 10-minute break.